Let me say this about General McChrystal, with all due respect. His recommendations to the president should go up the line of command. They shouldn't be in press conferences.
Speaker of the House Nancy Pelosi scolding the general in charge of Afghanistan, telling him to keep his advice private for the president.
And President Obama gets to hear from about 30 or so generals, or so-called generals, and members of Congress this afternoon. Top Line starts right now.
Hello and welcome to ABCNews.com's Top Line. I'm David Chalian.
And I'm Rick Klein.
Each weekday we're bringing you the very latest political headlines, reporting, insight, analysis, everything you need and want to know about politics.
And you can keep the conversation going all day long via Twitter. It's twitter.com/The Note. Let us know what you think.
Kick us off. What is your top line today? Where are you starting?
Afghanistan advice. Careful what you wish for, but President Obama has summoned some 36 members of Congress to the White House this afternoon to talk turkey on Afghanistan, and he is going to get a range of opinions. This is the first time that Republican leaders have been invited formally to the White House in some 6 months, and I think they'll get an earful and be sharing their opinions, which are probably quite a bit different than we hear from the other side. We see Nancy Pelosi and some other Democrats critical of General McChrystal, not just in the strategy that he has recommended of additional troops, but also in the method in which he's conveying his recommendations.
The White House says that this will sort of be a two-way conversation. There will be a briefing from Obama and Biden and the National Security Advisor to the members, but that they also want to listen to what they have to say. The one thing Robert Gibbs, the White House press secretary, was making very clear yesterday from the podium, Rick, was that there's no getting out of Afghanistan. So this is not, the debate is not like, oh, should we wind down and take out? That's not where we are. We're going to be in Afghanistan, and Gates and Clinton said this last night too, and we're going to be there for a long time. Republicans for health care. Just none with senator before their name and actually have votes on the floor. This is a new strategy coming out from the White House. They're starting to roll out high-profile, nationally recognizable Republican names supporting the president's health care efforts. They're coming from the states and cities around the country. Today, Arnold Schwarzenegger, the governor of California, added his voice to this, and this really is methodically being rolled out with a big White House push for it. Michael Bloomberg, the mayor of New York, who was a Republican, now independent, but running as a Republican up there in New York. Tommy Thompson, former presidential candidate in 2007-8, and
Bill Frist.
who am I missing? Thank you, Bill Frist, the senator, former Republican leader. So they're starting to collect these chits, if you will, trying to make an appeal to the country that it is a bipartisan effort.
And trying to isolate Republicans who are poised to vote against this. And none of this is going to change any of the votes. I like the idea that Bill Frist, after leaving the Senate, now people are going to start listening to him in the Republican caucus.
Are you suggesting they didn't listen to him when he was
Well,
leader?
it was maybe a little bit harder. Herding cats is the phrase that they often use over there. Storming the castle. Mike Castle, the Democratic representative from Delaware, the Republican representative from Delaware, is in the Senate race in Delaware, and this is a recruiting coup for Republicans. It puts a blue state and Joe Biden's old seat in play for Republicans in 2010, and the spotlight is going to be on Beau Biden, the Delaware Attorney General, the son of the vice president. Does he want to give it a shot in what may be a very difficult race against a popular statewide figure like Mike Castle?
The answer, I think, is yes. I think we're hearing mostly out of Delaware that Beau Biden is likely to jump into this race. This is a disaster for Joe Biden, the vice president. The fact that he could not keep his good friend Mike Castle from running in this race. Also, the fact that the environment is such that Mike Castle thinks it's worth giving up this very safe House seat that he, had for life if he wanted it. For Democrats on the House side, they'll have a huge pickup opportunity for that Mike Castle seat. But this is to have Delaware be a top-tier Senate race is real bad news for the Democrats. And finally today, also with politics, trail mix. A little bit on the 2009 New Jersey and Virginia governor's races. New poll out in New Jersey today showing basically a dead heat between Corzine and Christie. We have just seen Chris Christie, the Republican candidate, Rick, in New Jersey, keep falling because of this barrage of negative advertising that Corzine has launched upon him. Corzine not moving up much, but the independent candidate there getting enough support that Democrats are starting to feel that Corzine may be one of these anomalies of this just an unpopular governor who may indeed get reelected in a blue state. In Virginia, fascinating battle for women voters. You've got the Republican candidate through the RGA and others advertising against Craig Deeds, the Democrat, for this snippy comment he made to a female reporter. And you have Meg Whitman Republican gubernatorial candidate in California now begging off doing a fundraiser because of that thesis we've talked about and those controversial comments that Bob McDonnell, the Republican candidate in Virginia, had made years ago.
And a potentially big moment in that the candidate forum tonight on our ABC affiliate here in Washington, sponsored also by Politico. It should be interesting to watch.
4 weeks from today, so you've got 4 more shopping weeks left before those contests, folks. We're going to begin with the big healthcare debate and the debate over Afghanistan policy with Senator Orrin Hatch, Republican of Utah. He joins us up on Capitol Hill. He's a member of the Senate Finance Committee, which is where I want to begin with you, sir. Thank you for being here. We thought we might get a vote out of Finance Committee on healthcare this week, and that seems like it may have slipped to next week as we await what you guys call a score, basically a price tag from the Independent Congressional Budget Office. Do you have a sense right now how far off the mark from that price that President Obama mentioned in his joint address, in his speech to the joint session, $900 billion over 10 years? Is that the ballpark of what we're looking at here, do you think?
Well, it's a shame that we couldn't get the language of the Senator Bunning's amendment passed that would require an official score based upon official language in the bill. We're working off what is not an official bill at this particular point. And I suspect that the Democrats have the votes to get it out of committee, but it's going to be a disaster in my opinion. And I think in the end, no matter what the CBO scores it, it's always going to cost a lot more than that. That's always been our experience in the past.
Senator Bill Frist, Tommy Thompson, Arnold Schwarzenegger all saying that they support these reform efforts. What do they not see eye to eye on? What are they getting wrong in your opinion?
Well, we all support reform efforts. Everybody knows we've got to reform our health care system in this country. The question is, what are we going to do? You know, I remember when they made the promises in the past, when we, in 1964-65, when Medicare came up, they said, look, we're going to have a level playing field, no problem. It wasn't very long till afterwards they had to set prices, and of course Medicare has been paying doctors 20% less, hospitals 30% less, and it's going to get worse. And there is no level playing field once the government gets in, because the government will then start setting prices. And keep in mind, in this bill in the Senate Finance Committee, that's not going to be the final bill. The final bill is being written right now in the White House and in dark rooms up here in the Capitol Hill. And it's being written by partisan Democrats, and we're just going to have to see how it turns out in the end. But that's what's really going to happen here.
Right. Senator, you say everybody is for reform, but these Republicans, today Governor Schwarzenegger, yesterday Mayor Michael Bloomberg of New York, they're actually supporting the healthcare reform efforts that President Obama has introduced. And Michael Bloomberg went so far as to say that he sees this as a bipartisan effort because Republican ideas have been incorporated into this reform.
Well, not very many of them, I got to tell you that, if any. And frankly, I think they all say they support reform because we all do. Everybody would like to have our health care system reformed so that it becomes something that will benefit everybody in our society and leave nobody out. On the other hand, when it comes to paying for it, we ought to at least have a score, and we ought to at least have the legislative language before we finally vote on it. And I don't think we're going to have either before this really comes up for a final vote.
Do these outside voices, including Senator Frist, the former majority leader in the Senate, do they matter at all in the way that you're looking at the bill?
Well, I watched Senator Frist this morning, and he was saying anything but what the Democrats have come up with. And I know that he believes that it should not be exactly the way the Democrats are coming up with it. And I don't believe these other Republicans are going to be for it when they see the final bill that's being written in the back rooms right now. But the Democrats do have the votes. They have 60 votes in the Senate. They've got a supermajority over in the House, and they can pass almost anything they want. But they're going to have to live with what they do, and American people are going to be... And look, one of the ways they want to pay for this is taking somewhere near $500 billion out of Medicare. Medicare is $38 trillion in unfunded liability. So we're going to take another $500 billion out of there?
Senator,
that's nuts. That's just nuts.
Senator, before we let you go, I want to turn your attention to Afghanistan for a moment. You know that the president is meeting with bipartisan, bicameral leaders from Congress today down at the White House. It seems that Speaker Pelosi, Defense Secretary Gates, National Security Advisor Jim Jones, there seems to be a bit of a scolding of General McChrystal right now in the public for the fact that he made his advice to the president a little too public, and that they're suggesting it really should have gone up through the chain of command. Did McChrystal step out of bounds a little bit here?
Well, you know, some people think he did. I don't. I think we want straightforward language on what needs to be done over there. And McChrystal, I think, is just saying, look, if you're going to put our young men and women at risk over here, we've got to have the right type of equipment, we've got to have the right type of forces, we've got to have more support from back in the country, and it's just a matter of fact. And it just seems like it's taking a long time to make a decision that really ought to have been made a while back. And we're putting, every day, we're putting a lot of these young people at risk, and we saw what happened last week. So, you know, I'm for General McChrystal, and I know these other men, you know, they're good people, and they're trying to make a point that it's, you know, we've got to have everybody involved and hopefully make the right decision in the end. But I'd listen to McChrystal, boy. He's there on the ground. He knows what's going to happen, and he knows what needs to be done.
Senator Orrin Hatch, Republican of Utah, we thank you very much, sir, for being here today.
Thank you.
Thanks, Senator.
Greatly appreciate it.